Thank you for joining me today. In this video, you will learn ADHD. ADHD, Attention Deficit Hyperactive Disorder. So ADHD is a neurological developmental disorder with onset in a childhood. So it's neurological developmental disorder that happens in childhood. It is persistent pattern of inattention and hyperactivity, impulsivity that interferes with their function across the multiple settings, like home, school. So ADHD, it will affect the school and social. Symptoms begin before the child is 12 years old. Frequently persist into a childhood and adult. So the symptoms and behavior continues even when the child become teenagers and adults. They will still have that ADHD behavior and impulsivity and inattentive behaviors. Core symptoms include inattention, so careless, mistakes, difficulty sustaining attention. It's hard for them to pay attention. Seems not to be listening, but failure to finish the task. So they seem not listening to you, but they fail the task, fail to finish the task. They have poor organization, avoid sustain mental effort. They loses atoms, easily distracted and forget. Hyperactivity and impulsivity. They are fidgety, leave a seat, they run and climb and inappropriately. Excessive talking, difficulty waiting, they have a difficulty to wait. Interrupts and intrusion of the others. They interrupt others, intrude others. Threshold. Children younger than 16, between 16, they have to have 6 symptoms or greater in domain. Age 17 and adults have 5 symptoms or more to be diagnosed on ADHD. Presentation is so predominantly they have inattentive. Predominantly they have hyperactive impulsivity. Sometimes they have a combination of both. Presentation may change with age. Hyperactivity often weakness and inattention persist. So more the patient get older, they can control their impulsivity. So it gets better, but inattentive continues. Comorbidity include learning disorder, ADHD, anxiety and depression, sleep disorder, family history is common. So the children or the patient with ADHD have learning disorder, they have ADHD or DD, anxiety, they have depression, they have sleep disturbance. Assessment and diagnosis tools include clinical diagnosis using the DSM-5 criteria, multiple information report, so you will gather information from the parents, teachers, you will use rating scales, rule out mimic symptoms like sleep disorder, anxiety disorder, mood disorder, learning disorder. You will rule those out if you want to rule those out to diagnose ADHD. The treatment for ADHD include multiple approach of education, behavior strategy, medication when indicated. Age, tailor, and symptom target treatment. Psychosocial and educational interventions. You will use behavior therapy, parent training, classroom behavior planning, school accommodation, structural breaks, sitting, extra time provided for the child, skill coaching, organizational and time management. You will teach organization and time management. Younger children, behavior therapy, emphasize. Older children and teenagers combined with medication. So first line of treatment for moderate to severe impairment of ADHD is the stimulant. Stimulant is the first line of treatment. Methylphenidate and amphetamine are the first line of treatment. Most effective for core symptoms, rapid onset, symptoms are effective symptoms include appetite suppression, insomnia. This medication causes insomnia, appetite suppression, increased heart rate, increased blood pressure, cause irritation. They also cause, you want to monitor the growth and vital signs. Non-stimulant medications include atomoxetine, is a norepinephrine reuptake inhibitor. Also, alpha-2 agent guanfacine, clonidine, helps the hyperactive and sleep. Used if the stimulant is not tolerated or contraindicated. Special considerations include tics and anxiety. Consider non-stimulant careful stimulant selection. Substance misuse risk. Refer long-term acting formation or non-stimulant, because some patients use the stimulant for abuse purposes. They use the stimulant, so you wanted assess the risk of misuse of the stimulant. Comorbidity disorders, you want to assess and treat the comorbidity disorders. Treatment correct, like you want to use cognitive behavior therapy for anxiety. You want to monitor baseline, follow up, blood pressure, heart rate. You want to monitor the weight and height, sleep and appetite, assess the symptoms respond, and school function regularly. Differential diagnoses include anxiety, depression, learning disorder, sleep disorder, autism spectrum, ODD, and the anxiety, depression will cause the key disturbances that will cause is inattentive, secondary to mood worsening, so it will make the mood more worse if the child have anxiety and depression with the ADHD. Learning disorder, context specifically academic deficit, it will lead more academic deficit. Sleep disorder, if they have a sleep disorder with the ADD, they will sleep daytime, inattentive, poor sleep. If they have comorbidity of ADHD, they will have social deficit plus restrictive behavior. ODD, they will have defiance without a core inattention. Diagnosis: chronic course may improve with the structural support. Inattention often persists. Functional gain common with treatment. Onset is before 12 years. You want to assist them in a multiple setting that is required. Stimulant is the first line of treatment, medication treatment, unless contraindicated. You want to combine behavior therapy with medication for best outcome. Persistent can evolve over time. Thank you for joining me today. I would love to see you in my next video. Please subscribe and join me next. Thank you.